Dr. Kangas. How are you?
Hello, Cory. Very good. Thank you. How are you?
I'm good. Thank you so much for taking the time to chat tonight. I said to all of our people on Instagram that I was feeling like I needed to have like a good dog nerd session. So I am so excited to chat, and thank you for taking the time.
Absolutely. My pleasure to be here.
Awesome. So while people are joining, I thought I would just do some super quick intros. So hi, everybody. For those of you who don't know, I'm Cory, one of the co-founders of Dogly, and I'm so excited to have Dr. Katie Kangas with us tonight to chat about joint health. For anybody that doesn't know, Dr. Kangas is one of our favorite vets. She's an integrative vet out of San Diego with integrative veterinary care. And we learn so much from you every time we chat. So thank you so much for joining. And she's also a holistic advocate on Dogly. So for anybody that hasn't checked out her community yet on Dogly, she has been sharing some not only amazing things about joint health, but she's been covering so many different topics. So we will put Dr. Kangas's advocate community in the comments. So definitely go check out everything that she's sharing. And specifically, I know you have a lot more to come as well, but I know that you have been, you've already been sharing a lot about joint health in your advocate community, and I know you have more to come. So if you haven't read what she shared yet or watched her videos, definitely do that as well. But I want to keep this to like 20 minutes, and I know it's a huge topic to talk about. So maybe we'll have you back and chat some more. But joint health or care seems to be one of the biggest questions that we get, or most common questions that we get from people, and I'm sure you must see all sorts of issues all the time. And for me, it's almost one of the saddest things to watch dogs go through, because they, like they have at least our dogs have so much fun, like running around the backyard, and when you see them kind of starting to get like stiff or achy or whatever, they just like lose that joy. So taking care of their joints early on and with prevention, obviously, is something that's really important. So I thought I have a list of questions, and I'm gonna keep an eye on the time. But I thought, can we start out by just talking about like why joint issues are so prevalent?
Mm-hmm. Absolutely. So, as you said, it's a really common question. A lot of people ask about it. That's because so many dogs are affected by it. And statistic estimates are that at least 20% of the canine population in our country is affected by arthritis or joint problems. And, most of us know that as the body ages, whether you're human or dog, your likelihood of getting arthritis is probably going to increase as you age. But it's not always an age-related issue. And we all know that there are many young dogs, or many young people even, that have joint problems. And so it can affect all ages. And actually, there's a lot of joint issues that are congenital. And so most people have heard of hip dysplasia, although that sometimes gets misinterpreted. A lot of people will sort of think any hip arthritis is hip dysplasia, but technically dysplasia of hips or elbows or other joints is a congenital issue where that joint didn't develop properly as a young, growing dog into their joints. It wasn't formed properly. And that's what sets that joint up for degenerative changes and problems, inflammation from the get-go, even as a young animal. So elbow dysplasia, which leads to elbow arthritis, is a big deal in larger breed dogs, and hip dysplasia as well. But there's other congenital joint problems, and certainly there's the typical arthritis, which is wear and tear on the cartilage and structures within the joints that can occur obviously more with perhaps a lot of activity, performance dogs, a lot of rambunctious behaviors and things like that, or simple aging over time. So that's why so many pets are affected. And then one other, well, actually a couple other things that I can add in right away that increases its common incidence is that there are a lot of pets also that are overweight, okay? And anytime the body is carrying extra weight on the joints, it adds more wear and tear, which is gonna lead to more degeneration of, you know, the joint tissue. So keeping our dogs at an optimum lean body weight is absolutely huge. Very, very important and impactful for them to stay healthy in numerous ways, and especially with joints. And then another reason why arthritis and other inflammatory problems are becoming, you know, more and more common is because of, you know, poor diet and processed foods and, you know, things that are leading to inflammation in the body as a whole, which is of course also affecting joints. So very common problem across many species. And that's why it's a great topic for us to cover tonight.
Yeah. So now I have so many more questions after going through all that.
I have a part 1, a part 2, and a part 3.
I know. I mean, there's just so
let our audience know that I posted the first part of the joint discussion. I posted a few days ago as part 1. I just posted another today as part 2. Part 1, we introduce arthritis, kind of define it a little bit, talk about its incidence and why it's occurring. And then part 2, we talk about some things that we can start to do proactively, weight management and some environmental things. What can we provide our dogs to make things easier for them, like ramps and stairs and, you know, cushioned beds and things like that. And then part 3, we're going to get more into nutrition and specific nutritional supplements and medicinal foods that will help support better joint health. So we're going to have 3 parts to the written series, and so we can always meet again.
We might have to come back and chat. Yeah. So, and I think in part 2 you have a really cute participant in your video, if I'm not wrong.
Yes. So I'll post my video. I just shot a 3-minute video today with my doggy Sage modeling the optimum weight, which she's a wonderful poster child because she's a Labrador, a yellow lab, and most labs are, you know, they tend to be more prone to being overweight. Then, you know, there's some breeds that stay pretty lean. I mean, anybody can be overweight, but there are some breeds that tend to stay lean and others that tend to have a little more problems. And my dog, Sage, is wonderful example because a lot of people are like, oh my gosh, a lean Labrador. I'm like, yeah. So anyway, she stars in my video.
Yeah, I was just going to say, it's such an, I think we always forget about weight affecting our dog's joints. Like you know, obviously when we see an obese dog or cat or whatever, you know, whatever pet, you think about like needing to get their weight down, or I think a lot of people's first reaction is like, oh, that's really cute, when not cute. But I think a lot of people don't equate, you know, weight management with keeping their joints healthy.
Yeah, it's so true. And actually I could share something really briefly, Cory, that I like to share with my clients, because to me this is really profound information. And so often when, you know, veterinarians or even human physicians, when, you know, people are discussing arthritis, we're very quick to prescribe medication because we know that can be helpful. We know, you know, that can work. But a lot of times we don't have that earnest discussion on how much impact you can make for your pet by just reducing their body weight. And you know, if you just quickly tell somebody, oh yeah, you know, you should get your weight off your pet, and they're like, yeah, whatever, you know, I get it. But it's not motivating enough to really sometimes cause people to make those changes. So here's something that's profoundly motivating. Is there was a study that was done a number of years ago now on for hip arthritis in dogs, okay? But you could extrapolate this to other joints. You could be talking about knees or shoulders or elbows or whatever. But they took a large group of dogs with hip arthritis and they broke them out into 4 different groups and treated them 4 different ways and followed them out for an entire year. Okay, so this is a well-done study. And rather than just subjectively watching them walk to see how their progress was, this was actually done very objectively, meaning they had them walk across a weighted plate and measured how much weight they were putting on their limbs, okay? And so what they did with these 4 groups is the first group, they did pain medication, which some people may know. Typical arthritis medication for dogs is like Rimadyl, Carprofen, Metacam, Daramax. It's stuff that's in the nonsteroidal anti-inflammatory category, like aspirin for us, okay, or ibuprofen. So first group of dogs was treated with pain medication. Second group of dogs, joint supplements like glucosamine, chondroit, and stuff like that. Third group of dogs, weight management only, no supplements, no, no pain medication. They just got them to a lean body weight. Fourth group of dogs, total hip replacement. Okay, they gave them new hips surgically. Followed them out for an entire year. Guess which group had the most success?
Oh my God.
Weight management, hands down. Hands down. More than surgery. Is that not profound? Like more than surgery, more than pain medication. And for a big dog, Rimadyl costs like $2 a day.
Right.
And it can be harmful to the liver. It can absolutely cause gut ulcers and GI. The biggest issue with NSAIDs or aspirin, ibuprofen type drugs for anybody is gut problems. So talk about the cheapest, safest, and most effective way to protect your dog's joints and give them the best mobility, the best chance at longer quality of life, better quality of life, is simply to keep them lean. I mean,
it is insane.
Isn't that super cool to know? Now that's motivating. When people hear that, they're like, okay, I get it. I'm gonna work on this, and we're gonna do it, and it's gonna be fun. And guess what? I'm gonna save money,
right.
And my dog's gonna be happier.
Yeah. And if we knew that before our dogs gain the weight, I think if that's something in our heads of like keeping our dogs lean, not only for like all the other many health reasons that you want to keep your dogs lean, but if nothing else, thinking about their joint health and just knowing that that study is huge. I mean, that just like makes me, for that reason alone, it makes me want to keep my dog lean.
Isn't that cool? Yeah, it's really, really fantastic. So
that's awesome. Oh my gosh. Okay, so now my mind is blown. I think every time we talk, I'm like, mind blown about everything. But so that leads me to sort of a similar question in that talking about prevention just in general. So, thinking about, obviously, now we know that we want to keep our dogs lean. That's one way of prevention in terms of joint care. And is there anything else that, like, for example, my dog is 2.5. And you don't, when you have a younger dog, you don't really think about, or at least I didn't used to think about joint care, because it seems like it should be something that only affects older dogs. But I hear all the time about dogs needing surgery when they're younger, when they're 4 or something like that. Are there things that we should be doing, like when our dog is healthy, that can help them down the road?
Absolutely. So feeding them well is, of course, the best thing that we can do. Spending money on the front side with good diet is worth every penny, and a good diet, a fresher food diet, a lower processed, not a heavily processed diet right off the bat is already going to support the tissues in their joints better. And then you can do specific joint supplements as well. I'm, of course, a big fan of food-based supplements. So I really like to do things like bone broth and the omega-3 fatty acids, whether that is done with food items like occasional or regular sardines and salmon and anchovies and things like that, or a quality fish oil, krill oil, cod liver oil, that kind of thing. Organ meats are also very helpful for promoting strength of tendons and ligaments, by the way. So, fresher food diet or raw food diet that includes organ meat. I always like to include organ meat, typically a little more on top of that, whether that shows up as air-dried organ meat treats or freeze-dried, or you're, supplementing it yourself, doing that for your pet, maybe cooking up some organ meats or whatnot. But all of those things can be very beneficial to help keep those joint structures strong and flexible. So
that's great. So it's all like easy things that we can all do just by like improving their bowl, basically.
Exactly.
Awesome.
Great and to be proactive.
Yeah. And what about for dogs who are already experiencing whether they're senior dogs or not, if they're already experiencing some sort of joint issue, is there something that they should be doing? Is it different? Like if they're not experiencing joint issues, should they be doing this? And then if they're already experiencing some type of issues?
Yeah, great question. If they're already experiencing joint issues, I would do all the things that we just talked about too. You know, number one, try and get weight, you know, down, and support their movement. So, you know, even if they are having joint issues, this is, you know, something else that should show up in my postings as well, is what it should be in the one I just posted today, is it's still helpful to get them up and get them moving. Just let them go at a slow pace and not, you know, overdo it. But blood flow absolutely has been shown to help joints. So, you know, staying sedentary all the time is not helpful, you know, or can obviously make a difference for them. So getting them moving is very beneficial as well.
Great. And I have two last questions, and I'm very mindful of the time. So I have two final questions. My second to last question is joint care a breed? Like, should certain breeds be more aware of taking, whether it's preventative measures or just being aware that their dogs may have maybe more likely to have joint issues down the road? Like I feel like I hear about, you know, pit bull type dogs having a lot of surgeries for things, and like we have a Doxy, and we're very aware of his back. Like, is that a thing, or is it?
And I'm glad you brought up your Doxy too, because I wanted to just go back and you know, your last question about if they're already experiencing joint issues, everything that we just talked about. But I did want to mention too that if people have access to a holistic practitioner such as myself, or even a chiropractor, absolutely, acupuncture, chiropractic, you know, there's a lot of herbal medications and other very specific nutritional supplements that can support the joints, that can bring down inflammation, that can address pain in a natural way, you know, even CBD oil. I mean, there's lots of different things that we could discuss here. And, you know, bringing up your Doxy, of course, back problems is something I see a lot as a holistic practitioner, doing Chinese medicine, doing acupuncture, and that can be a tremendous benefit for back problems, as can chiropractic is wonderful for dachshunds and, you know, any breed really. Definitely breeds that are active and have a lot of, you know, performance activity level, but also dachshunds and breeds that are prone to issues. And certainly there are other breeds, like you mentioned, you know, pitties, and any large breed dog really can be more prone to knee injuries, the ruptured cruciate ligament that we hear, you know, you may hear ACL or even a CCL in a dog, which is the cranial cruciate ligament. And that ruptures oftentimes, and that's what so many dogs are having these surgeries for, TPLO and so forth. And that is very common. Now, little breed dogs, though, can get their thing. So one of the things that's typical for small breed dogs is something called luxating patellas, which is basically dislocating kneecaps, okay? Oftentimes, though, they can get away without, you know, most of these dogs don't necessarily need surgical repair for it. So especially if they're at a leaner body weight, luxating patellas, oftentimes they can, you know, function just fine without needing surgery. But again, the longer that they have those issues, I mean, it's still going to promote inflammation in that joint. So protecting them with lean body weight, good foods, good supplements is going to help them age more gracefully and maintain their highest function and mobility better than they would otherwise. So that's great. So
it sounds like we should be working on joint prevention or joint care prevention for all dogs. I mean, I guess there's more like, there's some breeds that are maybe in size dogs more likely to have issues, but it sounds like everybody should be taking care.
They can happen across the board. So yep, absolutely.
Great. Okay, my last question. So we had somebody send in a question, and I'm just going to read it. She says, I recently purchased a bottle of Dasaquin tablets without MSM for my 11-year-old dog. I adopted him this year, and he had stiff legs and creaky sounding joints when we got him but is still kind of an active little guy. I'd love to know your thoughts.
Okay.
What do you think about Dasequin or anything like that?
Yeah, so Dasequin is one that's recommended by a lot of veterinarians. A lot of vets do carry that, so it's a pretty commonly used joint supplement. And I think that Dasequin is pretty well liked by many people that are using it. But what I will tell you with any of the joint supplements with glucosamine and chondroitin is that some people see what they think are good effects for their dogs, and some people don't, aren't able to tell the difference. So there are things that I think are oftentimes more effective than a typical glucosamine chondroitin supplement. And again, I think bone broth is probably, going to give more results because it's got those components in it plus more in a very bioavailable form. Hyaluronic acid is something that's in a lot of joint supplements as well. And I know this person mentioned MSM, which is an anti-inflammatory, is in a lot of supplements. There are there's numerous joint supplements out there that contain those types of ingredients plus other herbal additions like turmeric and boswellia and bromelain, and some of these other things that are known to help joints. So, maybe a more comprehensive formula might be even a little bit better. But Dasequin is totally fine, totally great. She's got it. I would absolutely support using it. It's a good product. I just encourage people to try and monitor or observe whether it's actually helping, if it appears to be helping their pet. And so sometimes people will go through a jar and then maybe stop it. And if they see a difference that their pet was better on it, then by all means, it's worth the money of buying another jar. But I really like to help people spend their money wisely. So if they can't see necessarily a difference, or if you're just doing it preemptively, but then I would probably just do, food. But I kind of encourage people to, funnel their money and their resources to what really is helping that particular pet. So, and sometimes that can be different from individual to individual. So
I told her about your sardine trick, or not even trick, just like your sardine tip that
right.
We are now doing with our 15-year-old. Actually, all of our dogs are now getting sardines, but especially Zoe, who's our 15-year-old, is getting an ample amount of sardines and bone broth and all the good stuff. Keep her running around and chasing my 2.5-year-old. But that is right on time. We nailed it, perfectly timed. I can't thank you enough for taking the time. I know you're beyond busy, so thank you so much for coming on and talking about joint care. And we are definitely going to have another chat, and we can dive deeper into different supplements and care and all the things that we can be doing. So hopefully we can do this again soon. And for everybody that's watching, please check out what Dr. Kangas has been sharing in her holistic community. I can't tell you how much I've learned from everything that you've been sharing. So we've put everything in the comments, so have a look. Let us know what you think. Let us know if you learn anything. And yeah, thanks everybody for joining. Thank you, Dr. Kangas.
Thank you, Cory. It was my pleasure. Fun to join you as always. And I'll look forward to the next time.
Awesome. Great. Thank you so much. Have a good night, everybody.
Thank you.
Thank you. Great.
Yay.
Yay. Thank you so much.
Yeah, that was fabulous. I think that was really, really great.